If you think you might be pregnant, one of the first questions that comes to mind is, when should I take a pregnancy test? There are 3 important things to consider when choosing the best time to take a pregnancy test. When the test is most likely to be accurate, the earliest possible time you can test. And finally, the best time of day to use a urine home pregnancy test. First, let's talk about which day to take a pregnancy test when it is most likely to give an accurate result. The most accurate time to take a pregnancy test is about 5 to 7 days after you have missed your period. This is when your body has had enough time to build up the pregnancy hormone. This hormone is called HCG, and it can be detected in urine. This hormone starts to appear in your urine after a fertilized egg implants into the wall of your uterus. While implantation can occur 6 to 12 days after ovulation, it takes several more days for the HCG to reach a level high enough to show up on a home pregnancy test. If your cycles are regular and predictable, testing a full week after your expected period is usually when you will have the most accurate results. But naturally, many people do not want to wait several days after a missed period. So, what is the earliest possible time you can test? It is possible to get a positive result as early as 10 to 14 days after ovulation. This is about a few days before your expected period. But remember that if you get a negative result, you may need to test again in a few days. Getting a false negative result is more common when testing very early. A false negative means that you are pregnant, but there is not enough detectable HCG in the body to make the home pregnancy test positive. If you get a positive result, call your doctor to go in to confirm the pregnancy via a blood test. If you get a negative result before your period and still feel pregnancy symptoms or your period doesn't show up, try testing again in a few days. Now let's talk about the best time of day to take a pregnancy test. This would be first thing in the morning and using your first urine of the day for the test. Why? Because your urine is more concentrated after several hours of sleep, meaning it's more likely to have higher levels of HCG if you're pregnant. This is especially important if you're testing early or before your missed period, when hormone levels might still be low. Testing later in the day, especially after drinking a lot of fluids, can dilute your urine and make it harder for the test to detect pregnancy. Bottom line, the best way to get accurate results is to take a pregnancy test several days to 1 week after a missed period, and to take the test first thing in the morning. If you're testing early, just know that even the most sensitive tests might not pick up on pregnancy yet. And this means you may need a second test a few days later.